My name is Consuelo Wilkins, and I am a professor of medicine at Vanderbilt University Medical Center, and I am pleased to share my presentation for this panel. Thanks to the organizers for the invitation, and really delighted to share this platform with the other distinguished panelists. So my focus is going to be on diversity in genomics and really emphasizing how we will fail unless we de-biologize race. And I know that might be a little bit of a different slant than people are expecting as we're talking about diversity in genomics. So I think some of the important pieces around that and what I'd like to convey in this presentation is that we are spending a lot of time talking about diversity in genomics, yet although it's greatly needed, we're not clearly defining what we mean by diversity. So are we talking about diversity in ancestry? Are you talking about diversity in race, ethnicity, health status, social factors? All of those things are really important to be clear about. And maybe we're talking about being diversity in all of those things. It's also really important to think about what race means as a social construct, especially since these terms are often conflated, ancestry and race. And race, if we agree and accept that it is a social construct, then how will we actually begin to disentangle these two things? And then finally, I want to make the point about the importance of thinking through what standards around diversity would look like, specifically on the inclusion of race, ethnicity, as well as some of the social factors that are really important to consider. So let's move into what is diversity in genomics. So as we think about diversity, again, are we talking about ancestral populations? Do we really want to think about people based on their ancestry, based on many thousands of years of population migration? Are we looking across the entire world for where people of more recent ancestral patterns have migrated? So what does that look like? How are we defining it, and when? And so thinking through, again, just looking at this map of different groups, ethnic groups, populations, as how they identify and from what parts of the world they are migrating still to places that we would consider in the New World, like the Americas. Are we talking about the current population? Are we thinking about diversity in terms of the population of the world as it is now? So thinking about not necessarily the 7 continents, but perhaps more specifically about regions, as we tend to think about the world as obviously we're talking about Asia, Africa, and Europe as actual continents and regions here, but combining Latin America and the Caribbean, as well as Northern America, so not North America, because Mexico is included here in Latin America and the Caribbean, and as well as Oceania. So if we're thinking about these current population demographics, right now, 60% of the world's population lives in Asia. I would say most of the people who live there have ancestral populations who are from the continent. Similarly, the population of Africa is about 17%, and Europe is about 10%, and you can see the other demographics here. So as we strive for diversity in genomics and genomic research in particular, are we striving to have a diversity of individuals who represent this world population? And if so, are we planning to do that for the current population, which I just left, or are we actually looking at the population of the future? So in the lower right-hand corner here, you see the estimated population for 2050. So 30 years from now, it's estimated that we will have even more people. So that's comparison here is from 1950. So this is a 100-year difference, and you can see that the population of Asia is almost 4 times what it was 100 years ago. But the population of Africa is 10 times greater. So the growth rate, the change rate there is much greater, and the population in Europe is only 8%, expected to be only about 8% in 2050. So looking just at that 100-year difference, only about a little over 200,000 people more in Europe than there were 100 years ago. And what does that mean for actual science and how we think about delivering care as well? If we are still having data sets and doing genomics with a majority population from Europe or of European descent, and certainly looking at the Northern America, many of those individuals here are certainly of European descent, but certainly not all of them. So far less than the populations of Asia and Africa that we will be expecting in 2050 to be 80% of the world's population in just 30 years. So again, what kind of diversity are we talking about when we look at the diversity nationally? So looking at the U.S., this is individuals were asked what their backgrounds, their heritage, nationalities were. And so looking at the U.S. by counties, you can actually see here differences in the largest number of people per county. So it doesn't mean that they were 50% or more of the county, but the highest percentage of individuals who identified one specific ethnicity or nationality here. And you can see here still within the United States, a lot of variability. Not all individuals certainly are from of European descent. The yellowish gold represents individuals who identify as Mexican. Individuals in the light blue here in the Louisiana area, New Orleans area are identified as French. And still we have indigenous populations, tribes, Navajo people, Cherokee people, who also are representing in a few areas around the country these demographics. Are we talking about diversity in terms of health status? So if we're doing research, are we looking at differences in people based on, are we looking at genomics or genetics based on a disease? And if so, there's an example here of diabetes. So if we look at the prevalence of diabetes across the world, you can see here there are differences by continent or regions, and thinking back to the populations of Africa and Asia, you can see here a much smaller percentage of the population have diabetes. So thinking to 2020, where we have more than 1.3 billion people in Africa, only 14.2 million, I mean, it's still a lot of people. 14.2 million people in Africa in 2015 have diabetes. We're looking at North America and the Caribbean, where a smaller population of people, but more than threefold higher percentages of, at least in 2015, higher percentages of people with diabetes. So if we are studying diabetes, are we looking for a population of people that represent the disease? I would say so. If we're studying a specific condition, we should be studying the people who are most impacted by the disease. And if so, what does that look like? Perhaps we're talking about diversity in terms of social status or environment, and looking at something like this map is of the Human Development index, and so it takes into account social resources, educational opportunities. We're seeing more and using more things like the social vulnerability indices or area deprivation indices, where we're trying to consider what the environment is in which people live and the resources and opportunities. And so you can see here, if you're looking at this Human Development Index, the red, darker red colors have a lower indices, and so the amount of development, perhaps not surprising, the distribution here. And so again, if we're looking at people who might still have the same ancestral populations, then what does that look like from a health status? How does that interact with their genes? And what does that all mean in terms of diversity? Or are we talking about diversity in terms of race or ethnicity? And so thinking about race, which we often are, considering skin color, facial features, texture of hair. Are we talking about race, which many of us would say is a social construct? And although there is quite a bit of overlap for some people with ancestry, they are not the same. And race is a social construct and is more likely to be tied to some of the disadvantages related to infrastructure and social resources and opportunities. And so what kind of diversity is that, and how are we choosing that diversity? Are we choosing based on how people identify? Are we choosing on some other characteristic? And again, what does that mean? So as we consider those things in terms of diversity, going back to really one of the biggest challenges we have with determining diversity is distinguishing between race and ancestry. So race as a social construct has been biologized, so we often will conflate ancestry, so the ancestral populations, heritage, genes with race, and they should not be. And I'll tell you why I say that and why I think it's important to disentangle that. So if we look at race as, again, the social construct in the United States, we define race, the government defines race, the census, as a social, cultural, and political construction that is not biologically, anthropologically, or genetically based. So it's a social construct, people self-identify, it's fluid, meaning that it changes over time, and you can clearly see that as you look back over the census in the United States, you can see that individuals with the same ancestry, if we're talking about an individual right now, if you go back over time and look at decades of how they would be classified by the US Census, that could change. So an individual who has who identifies right now as African American could have been identified in the past as mulatto or a Negro, or now could actually identify as biracial. So certainly those things are important to consider and not discount what those social pieces are. But we have to recognize that there are different things. Race is not ancestry. Race, particularly in the United States, is more likely to be associated with social factors, structures, opportunities, and certainly racism. So the historical context of the term of race and the categorization of people in the United States has been primarily built on a system of oppression and a hierarchy that enslaved people were relegated to be in inferior status, and individuals who were white or of European ancestry were presumed to have some additional benefits, but also some of those benefits and the opportunities that they were allowed were at some point the line was blurred, and there's presumptions, or actually, I shouldn't say presumptions, there were false assumptions and actually information put forward to try and delineate and that try and state that these categories actually had some biological meanings when they did not. These are images from National Geographic in April of 2018, and the young ladies who you see on the cover are fraternal twins, and if you look at them, if they were walking down the street, going in different directions and not appearing to be with each other, you might not think they were related, and you might presume that they actually had different racial identities. And so what does that mean for them, two people who share parents, but physically appear different, and how they experience the world is also going to be very different. Similarly, you can see the images here, the 6 different people here have the same percentage ancestry markers from these different parts of the world, but they look differently phenotypically. So again, tying ancestry to what people look like, but also how they identify their culture, their ways of being, and how they interact with the world is not tied directly to ancestry. So in addition to the things that I've mentioned already about people being relegated to different statuses and having they're being presumed inferiority based on these racialized categories. Science, in particular, eugenics, has played an unfortunate role in that, and so certainly in the 1900s and even well into the 20th century, these propositions that people were different based on the size of their heads and other physical characteristics that could not actually be reproduced consistently, that there were presumptions made about people based on the color of their skin, and then tied to other things like the size of their head and other physical features. In particular, in the United States, this happened at the same time that enslaved Africans were stripped of all of their rights, their language, their opportunities. They were not free people. They, in fact, were penalized. They were not allowed to be educated, and at times that actually meant not just taking books away from them and not allowing them to learn a language in a new land, but actually physically harming them, and at times even killing people who were trying to educate themselves or others. And again, at the same time that this is occurring, people are, these eugenics is occurring, and people are making inferences about related to race, while individuals are not allowed to be educated, and they're segregated and labeled as intellectually inferior when they are not even given the opportunity to be educated, and again, not allowed to speak the languages that they brought with them from their homeland. This legacy still continues to today, and things that were based on racism and slavery and those sorts of things, like the spirometry, in which individuals, a physician who actually was a slaveholder put forward information about individuals who are enslaved Africans and Black people that really justified keeping them enslaved. And of course, an infamous rule that was in practice in some places within the United States used what we called the one-drop rule. It was a way of hypodescent, and that there was an automatic assignment of a person who was of mixed race, who had parents of different races. The individual who had lower, the racial group of lower, presumed lower status was the one that you presumed. And it really highlights the fact that, you know, race is one of the most imprecise variables and measures we use in human research, because it is not something that we can categorize. So you can have one great-grandparent who is Black and be considered Black, or you can have 8 great-grandparents who are Black and be Black. Now that, again, does not change that it is certainly your identity, and if it's your choice and that's how you, the culture and how you experience life, that's an important social category, but it is not genetic or biologic. And so what do we do about it as we continue to try and address the lack of diversity in genomics and move forward in a way that will allow us to best understand how genomics plays into health and well-being? And you know, some people have certainly pushed for us taking race out of human genetics, that we should completely separate them and not talk about them at all. Others, and you know, some geneticists have said that you know race isn't important, and I would say that that's not quite true. We just have to recognize that they are different things. And so if we're talking about ancestry, first of all, I think we should wonder, why is ancestry important? Is it only important so that we can make sure that we have enough diversity of people and databases that we're using? Or is it important for some other reason? Is it important for us to understand you know, genetic variants or polygenic risk scores or other things based on ancestry, or is it alone? Are those things important alone? And if we're using genetic ancestry, are we again conflating that with the environment and things that are happening, not because people are currently in different areas of the world, but because people are experiencing life differently based on social, economic, and other environmental circumstances. And so from this study, I think it's important to see and show that individuals, especially in the United States, who identify as African American, have a lot of admixture. You can see in the table at the top the proportion of people by their identified race and ancestry, the proportion of genetic ancestry based on ancestry markers. And then, you know, similarly in the same study, you can look at the graphs at the bottom, and you can see the difference actually in individuals in who identify as African. So people who are Ethiopian or Kenyan, and what their PCA looks like is different from people who identify as African American. So, you know, where will we draw these lines, and how will we distinguish these things? And in particular, as we think about the rigor of research and the reproducibility, being clear on these terms and the terminology is as important now than ever, that we not just focus on the biological variables, but what do we mean by these variables, and if we're talking about race, then how do we account for that? I akin this, you know, I liken this diversity in genomics to diversity in clinical trials in general, where we often really push for having people of different backgrounds included, but then we still don't know enough about them. We still have not included the most important and vital information to help us understand their health, and also to help us understand biological variables, or how they respond to treatments or medications. And so thinking about what those social determinants are, those social factors are, that we should also be collecting and including, is really critical. And so knowing things about an individual's, you know, educational background, opportunities for employment, neighborhood characteristics. In this study, in this paper, sorry, that not a study, it's a paper that we published earlier this year, we also emphasize the importance of understanding discrimination and how people experience life, and that interaction with society, that that does have a biological response. And so you can have a biological response to racism and discrimination, but those changes are not because of your race, it's because of the environment and the people and the social circumstance. And so I think making sure that we collect that information, as well as having ways for individuals to clearly identify themselves in ways that they would identify, and that includes allowing there to be a granular collection of race and ethnicity, not just these bolded areas, but branching to actually collect more detailed information about individuals, and allowing people to choose as many as they'd like. And I think we'll continue to see these emphasized in how we actually change standards or create standards around the use of race, ancestry, ethnicity, and I think it is to our advantage to do this for the good of science, but also to make sure that we are inclusive and considering what diversity really means for research, as well as patient care and population health. Thank you.